Procurement in healthcare. What is strategic procurement? It is a bright morning at Say Hospital, and Eric is reviewing a plan to produce new surgical equipment. This is strategic procurement, a proactive approach to acquiring goods, works, and services that gives an organization a competitive edge by reducing waste and adding value. Unlike routine purchasing, strategic procurement isn't just about buying, it's about aligning purchases with the hospital's mission, like improving patient care and expanding services. Strategic procurement doesn't happen in isolation, it must integrate with Say Hospital's broader goals, such as providing quality healthcare and managing costs. By being proactive, Eric ensures the hospital get the best resources efficiently, supporting its long-term success. Eric learns a hospital needs a new ultrasound machine. Instead of choosing the cheapest option, he researches suppliers, negotiates for a durable model, and ensures it fits the hospital's goal of improving maternal care. This saves cost in the long run and ensures patient outcomes. You can explain strategic procurement as a proactive process that aligns purchases with organizational goals to reduce waste and add value. Why strategic procurement matters. As Eric walks through Say Hospital's pharmacy, he reflects on why strategic procurement is growing in importance. It's not just about cutting costs, it's about adding value. Rapid changes like new medical technologies requires a team effort, and procurement professionals like Eric are now key players in strategic planning. In the past, procurement was seen as a clerical task, but today it's a strategic function. Its effectiveness depends on whether it's reactive or like just responding to needs or proactive, planning for the future. Eric's proactive approach helps Say Hospital stay ahead. When Say Hospital plans a new cardiology unit, Eric doesn't just buy heart monitors. He works with doctors to choose cutting edge models that improves diagnosis, aligning with the hospital's vision to be a regional leader in heart care. You understand why strategic procurement is vital for adding value and supporting organizational innovation. Now let's look at the concept of strategy. Eric sits in a meeting discussing Say Hospital's future. This is where strategy comes in, a plan that integrates the hospital's goals, policies, and actions into a cohesive whole. Strategy is like a roadmap guiding Say Hospital to allocate resources, widely based on its strengths, weaknesses, and external changes. It's the hospital's sense of purpose, often outlined in its mission statement, like providing quality healthcare for all. Say Hospital's mission is to serve Kumasi's growing population. Eric's strategy includes procuring mobile clinics to reach rural areas, ensuring the hospital meets its goal while addressing community needs. You can explain strategy as a plan that aligns an organization's goals and resources to achieve its purpose. Developing a strategy. Eric knows a good strategy requires careful thought. He asks, what are Say Hospital's objectives? How will we achieve them? Developing a strategy involves setting clear targets like improving patient care and choosing actions like investing in new equipment or training staff. It's about innovation, taking calculated risk, and making the right choices at the right time. Eric develops a strategy to reduce equipment downtime. He targets zero delays in surgeries by procuring backup generators and training technicians, ensuring Say Hospital operates smoothly even during power outages. You understand that developing a strategy involves setting goals, choosing actions, and embracing innovation to achieve goals. Let's move to strategic management. Eric Rose goes beyond planning. He is involved in strategic management, which has three key areas. 1. Strategic analysis. Assessing, say, a hospital's current position, like its budget or supplier relationships. 2. Strategic choices. Formulating options like buying or leasing equipment. 3. Strategic implementation. Putting plans into action, like signing contracts or training staff. Eric analyzes say hospitals' need for more ventilators, chooses to lease them for flexibility, and implements a maintenance schedule to keep them functional. This ensures ICU is always ready for critical patients. You can explain strategic management as analyzing, choosing, and implementing strategies to achieve organizational goals. Now we are moving to Michael Porter's five competitive forces. Eric knows a hospital operates in a competitive environment. He uses Michael Porter's five forces to understand these dynamics. 1. Bargaining power of supplies. High when supplies are few or their products are specialized. Only one supplier in Ghana provides a specific MRI machine, so Eric negotiates carefully to avoid high costs. 2. Bargaining power of buyers. High when buyers, like patients or insurers, have many choices. Patients choose their hospital for its reputation, giving Eric leverage to invest in quality equipment. 3. Potential new entrants. New hospital could compete, pushing Eric to innovate. A new clinic opens in Kumasi, so Eric procures advanced diagnostic tools to keep said hospital competitive. 4. Substitutes. Alternative treatment like herbal remedies could reduce demand. Example, Eric ensures their hospital offers affordable lab tests to compete with local herbalists. 5. Industry competition. Rivalry among hospitals drives improvement. Example, to outshine a rival hospital, Eric procures state of the art surgical tools, attracting more patients. You can identify Potter's five forces and how they shape strategic procurement decisions. Now let's move to public accountability in procurement. Eric sometimes works with the public hospitals, where public accountability is critical. Public sector procurement involves spending taxpayers' money, so it must be transparent and accountable. In Ghana, this means following the Public Procurement Act, Act 663, as amended. To prevent abuses and ensure fairness, public buyers like Eric must justify their decisions to auditors and even court, ensuring every cedi is spent wisely. Example, at a public hospital, Eric would procure wheelchairs through a transparent tender process, documenting every step to show taxpayers' money was used fairly, unlike the faster negotiations he uses at Say Hospital. You understand public accountability as the transparent and justifiable use of public funds in procurement. Let's go to general principles of government procurement. Eric knows public procurement in Ghana follows strict principles. 1. Value for money. Choosing the best overall value, not just the lowest price. 2. Competition. Using competitive bidding unless there's a valid reason not to. 3. Clear rules. Defining who specify needs, authorizes funds, and make purchases. 4. Separation of duties. Keeping contracting, receiving, and payment roles separate to prevent fraud. 5. Advertising. Publicizing high value tenders as required by law. At a public hospital, Eric advertises a tender for a new bed, separates the rules of selecting suppliers and authorizing payment, and ensures the chosen supplier offers the best value, complying with Ghana's procurement laws. You can explain the principles guiding government procurement in Ghana. Let's move to value for money, VFM, in public sector procurement. Eric often hears people assume public procurement is about picking the cheapest option. Not true. It's about value for money. VFM. Considering factors like lifetime cost of goods and services, supplier reliability and reputation, equipment specifications and quality, payment terms and transport costs, operations and maintenance costs, support and disposal options. Eric procures an X ray machine for a public hospital. Instead of the cheapest model, he chooses one with lower maintenance cost and reliable supplier, ensuring long term value for taxpayers' money. You understand value for money as a holistic approach of procurement, balancing cost, quality, and sustainability. As Eric closes his office at Say Hospital, he smiles, knowing his strategic procurement ensured a new ultrasound machine arrived today, ready to help expectant mothers. You followed his story, learning how strategic procurement aligns with organizational goals, uses strategic management, and navigate competitive forces. You've also seen how public accountability and value for money shape procurement in Ghana's public sector. Next time you visit a hospital, think about the equipment, medicine, and the unseen work of people like Eric. Ensuring every purchase support quality care. Strategic procurement is the foundation of healthcare excellence in Ghana. Thank you for joining this journey, and I encourage you to keep exploring this vital field. Until next lecture, bye.